this episode of Compliance Deconstructed, brought to you by Simply Compliance. Your hosts today are Jessica Zeff, yes, I did remember my name, and Elvan Baker, and we've got a really special guest. We've got Denise Lord from Monadnock Hospital in New Hampshire, and she's going to talk to us about her experiences working as a compliance officer in a critical access hospital. So Denise, welcome. We're so happy to have you.
Thank you so much. Happy to be here.
Of course. Would you mind introducing yourself and tell us, what you do, how you got here?
Sure.
Just a bit of background.
Absolutely. Denise Lord, I'm Vice President of Organizational Performance at Monadnock Community Hospital. We're a small critical access hospital located in Peterborough, New Hampshire. As part of my role, I oversee a whole, I call it a bread basket, or whole basket of different programs, including quality, survey readiness, infection prevention, risk management, patient experience, peer review, and of course, performance improvement. And I am compliance and HIPAA officer. There's quite a few programs under my umbrella. And I think, that brings up some challenges in and of itself, but it's a wonderful, wonderful opportunity here. I am a registered nurse, and I have been in the quality arena since probably over 40 years now. And I've worked in different settings, from acute care facilities, federal facilities, long-term care, managed care. And this one, by far, being in a critical access hospital, gives me the greatest joy.
Thank you for that. I mean, this is a lot of the reason I really love working with Denise. Mm-hmm. Denise wears many hats. Like, she comes with so much knowledge and experience. And we'll dig into that a little bit more and what that means, right? Mm-hmm. But she also has such a great style. She exhibits the characteristics or the values that I would expect from a compliance officer. And you can see that even from the way you speak, Denise. But I think that's absolutely brilliant, carrying that kind of seniority and all those skills and abilities and that knowledge, and being able to tie them together. And guys, if you're listening, well, hopefully you are listening, but you'll see what I mean as we get on. All right, so let's get started. Denise, thank you for that background.
Sure.
Thank you. First things first, I have to ask, for those who don't know, like myself, what is a critical access hospital? Can you give us a little bit of a overview? And kind of also, after you do that, maybe since you have such a broad experience as a clinician and in compliance roles, give us an understanding, an overview of how that's different in a critical access hospital doing what you do.
Sure. A critical access hospital is deemed by the Centers for Medicare and Medicare Services, or CMS. It's specifically deemed as a necessary hospital, typically located in rural or very remote areas of the United States. And it's typically 35 miles from another hospital, but most importantly, it has 24-hour emergency services to individuals who live in those remote locations. Working in a critical access hospital, since we are in remote areas, poses some specific challenges in that, with regards to resources. For many patients who come in with an acute condition, we're only able to offer basic services, stabilizing services. So we frequently need to transfer patients out to tertiary medical centers.
Okay, so just another follow-up question. I'm sorry, I may be going too deep on this and it may not be necessary for everybody to know, but this is number one, geography-based, number two, resource-based.
Yes.
Okay, and then there is a service component to it where, a critical access hospital needs to provide 24/7 emergency care and services at the very least.
Absolutely. There's also many critical access hospitals offer inpatient and outpatient services as well. We're fortunate to be able to have also a birthing unit, of which many rural hospitals.
But it only makes sense, right? You don't get to, we don't
many
schedule all the births anymore.
Yeah, rural hospitals are dropping their programs, unfortunately. But
really?
It's become, from a resource perspective, it's difficult to get the staffing, the trained staffing, and of course, the providers necessary to offer those services. They're typically going to the larger hospitals. But we're fortunate to still be able to offer that here.
Okay. So how long have you been working at Monadnock?
This is my 4th year.
Okay.
And I was actually born here.
Are you serious?
I'm very serious. Just 25 years ago.
That is superb.
Yeah,
okay.
Yeah.
Well, so I mean, we're talking about resources generally, and they're limited. And when you introduced yourself, you talked a bit about the different hats and the different roles that you take on. Could you tell us a bit more about those different hats, and maybe talk to us a bit about, why they're needed and how you manage it all?
Well, I think, having the multiple programs under one umbrella actually is an advantage here in the critical access hospital setting. I think in any setting, frankly. Typically, in a larger institution, you would have a separate risk management department, a separate medical staff department, a separate infection prevention. Those are typically encompassed in other areas or in their individual departments. I think that really makes it more of a siloed element. As a compliance officer, for example, you don't necessarily have your fingers in the day-to-day activities of those outside the department. Here in the department, I actually have oversight of all of that activity. And that really lends itself to getting a broader view of what's happening in the organization, and helps identify if there are any issues or concerns that someone wouldn't normally have access to. So really having that insight and the additional viewpoints really does help with regards to compliance monitoring and also supporting the program.
So I'm fascinated by this. As somebody who likes to have a broad overview and who likes to wear different hats, I mean, for the same reason that you do, it's seeing all those connections between different activities and different teams and being able to see compliance risk across different areas. This genuinely does fascinate me. What I don't understand is how you do it. So from a compliance or regulatory perspective, well, let's dig in a little bit deeper, right? So let's look at what you're covering. You're covering quality, compliance, privacy, infection control. What am I missing? Patient safety.
Case management and utilization review. We haven't mentioned that yet.
Yeah, case management, utilization review. So, I mean, this is a lot of different hats, and there is that benefit to it. You get oversight, broad oversight. But how do you manage it on a day-to-day basis? Do you have a team that helps you? How do you report?
I mean, I hope she does.
Superwoman.
Yes, I do have an awesome team. I have three registered nurses. They manage the day-to-day programs such as infection prevention and survey readiness, all of the regulatory activities, also administrative support in the form of a patient experience coordinator who also really manages the performance improvement element So helping teams, once we've identified an issue, she facilitates the work to correct it. I've had to be very creative in my prioritization. I have an electronic reminder to help keep me on track so that I'm not missing important dates. So how do I manage it? It's really a lot of planning, knowing what's coming up and, having enough time to prepare for it.
So how do you know those things? Like, how do you get that information? And do you have a compliance committee that helps you?
There's typically things that, I would do on a regular basis or routine basis, are auditing, meeting planning, agenda planning, day-to-day investigative work. But fortunately, I have an extremely engaged compliance committee who is instrumental in helping me to prioritize based on my risk assessment. So yeah, there's a lot to do. In a critical access hospital, when you think about it, we're still required to do the work that regular or, acute care hospitals in the cities would need to take care of. But we have to deal with it with smaller resources, with less resources. So it's really prioritizing, addressing the most important elements first, and relying on people outside of the department to be part of the program. And I think that's another major benefit of working in a critical access hospital. We're relying on people who we would normally not work with to conduct audits or assist in any investigations or meeting preparation and planning and presentations. So knowing who you can go to, who is helpful with regards to supporting the program, I think you really develop some key alliances there.
And I think that's really important when you're talking about planning and prioritizing. Actually, I don't want to underplay that element. I mean, we all have to do it, right, Elvan? In our work, we need to do this planning and prioritizing. But when you're working in a critical access hospital and people are wearing multiple hats and you're very limited on your resources, there are some really specific challenges. And I know, you and I have a unique relationship, Denise. So I've seen firsthand there's a lot of effort that goes into the compliance work plan, the risk assessment, and really having to prioritize hard and also being flexible enough to be able to adapt as you identify new risks, right? And I've seen how much effort you and your teams put into those processes. And Denise is completely right. I mean, to be fair, I've never seen a compliance committee that works so brilliantly. And you know everybody, and you have a very supportive team. And I just wonder, do you have any advice about how to go about building those relationships? I mean, people seem really engaged. Your compliance committee, Denise has attendees from every department. And when you look through the minutes of the meetings, people are really engaged and they're commenting and supporting, and there's great discussion. I just wonder, any hints and tips, like how do you build that?
First and foremost, it's really leadership support. That's crucial in really demonstrating the importance of the program. And if you have that leadership, that visible leadership support, then I think that's a very good first step. So really making sure that your leadership has a good understanding of the program, what the requirements are, and why it's important for them to be engaged. I think that's probably a good place to start. But you also need to make your meetings interesting. It shouldn't be just simply, here are the results of the audits. What I find is really in making sure that we're engaging every single person in that room and asking, so what do you think? Do you have other specific priorities that you think would be appropriate? Do you have anything else to offer? So working hard with your committee members, getting good relationships with them is also another important element, and to make sure that they are indeed involved in the conversations. And again, making your agendas so that they're not just very dry, but really to allow for open discussion and dialogue.
This sounds like exactly how compliance should be. It's everybody's job. It's not just one person in one department, because when the resources are tight, everybody takes ownership, right? And when everybody takes ownership in a compliance program, it's a lot more successful. So it makes me feel the way that Denise is explaining is that, man, I bet a lot more organizations and a lot more compliance officers wish they worked in your environment, because there is that bonding that brings everybody together in all that you do, not just the care, not just the compliance, not just the regulation, but everything, because we have to rely on each other. We're a small community. We work for a small organization. We are farther from the other resources. Therefore, I take ownership on everything I do, and I'm not going to just make excellence somebody else's job. It's not just Denise's and her department's job. It's all our jobs.
Right. And
this sounds very actually nice.
It is really nice. And to build upon, helping each other, it's not unusual for us to go to other departments to lend helping hands, because patient care comes first.
They need it.
Regardless. True. And, if we have the training and the skills and the ability, we're going to go out there and help as much as we can. And that really goes a long way. It gains the respect from frontline staff. We've had our CFO actually doing environmental service work in our emergency department for a number of years because of, scarce resources, but recognizing that the team is small and it's important that we rely on each other to provide the best, safest care possible. I think that is one of the key benefits. That's why I really love working in a critical access hospital, because you get to experience things in other departments and services that you normally wouldn't.
So jumping off of that, as compliance officers, we are used to dealing with the unexpected. It comes with the job description. Can I ask you though, Denise, how do you respond to the unexpected? Like, I don't know, someone calls you, there's let's pretend one of my favorites is there's a privacy issue you weren't expecting. And it comes out of the blue. And I mention that only because most of us listening can relate to that issue. You're the privacy or compliance officer, someone calls you, I think I have a privacy issue, or something's happened, and you totally, it blows your day away. How do you manage that?
That's a good question, because you're probably dealing with other priorities that are on your plate. But again, it's recognizing what is the most important thing at this particular time and being flexible so that I can address, the privacy concern right then and there. It's really being able to recognize and to triage, if you would. There's a fire here. Let's put the fire out here, and we're going to work on the other items as soon as we can, not to minimize them, but it really is having the flexibility to respond to those types of situations. You can't be so rigid where, I'm just focusing on, something today, because you need to be prepared for whatever comes, whatever happens to to fall upon you.
It's the unique challenge
I
of
have-
being a compliance officer, isn't it?
Mhm.
Go ahead, Elvan.
I have
sorry.
a question I'm dying to ask. Okay. I don't know why this question popped in my head, but it did. So therefore it must come out.
Brace
So,
yourself, Denise.
forbid.
Brace yourself.
No. Do you feel, because these are needed, as you explain what a critical access hospital is, few and far in between services that are needed to the population that's there. Regulators are aware of that. Do you feel when they come for a survey, when they come for an audit, like whatever that may be, do you feel like I'm going to say this, do you feel like they're nicer because they don't want to, for the lack of a better term, take everybody off and be like, enough with this. I am already short on resources. And now you're on top of me and I cannot meet that regulation because I don't have the resources, and heck with this. And I'm, because more and more people quitting that area ends up, I've seen it in my career where, regulators would not give any leeway about this and that, to a point where the clinicians are like, okay, enough. We don't have the resources to accomplish that here. And eventually enough of them left that the quality went down, and kind of it became like a chicken or the egg thing, right? The worse staff they've gotten, the worse regulatory compliance it became. So it kind of then they became known for all the tags that they received. Then they couldn't attract the right clinicians. You know what I'm saying? Do you feel like they're nicer?
No.
They're not more
No.
understanding.
No. They have their jobs to do.
You're right.
And we are held to the same standards and, level of performance that any other hospital would be held to. Our community, the people who come here, expect that we provide services that are outstanding, and that we are delivering that in a safe environment and an ethical environment. Even more so because we know each other. We're all part of our community, and we're taking care of our neighbors here that we actually know. So I wouldn't necessarily want a survey team to be nicer or more, I guess, forgiving, because we want to be able to meet the standards that everyone else is at.
Of course.
Are there any compliance obligations that are particular or unique to a critical access hospital? And I don't know the answer. I'm genuinely asking. I don't know.
I don't know if it's necessarily unique to a critical access hospital. What I can say is if something does happen, for example, if there's a privacy breach or some significant compliance concern, EMTALA, for example, it affects everyone. So it's not necessarily one of those incidents that only a few people will know about it. The entire organization may actually have some impact or may have some involvement in one way or another. So I don't think there's anything specific that I can point to that's unique for critical access hospital. I just think the scope and the reach of issues and concerns can certainly go a lot farther.
But I think that's an important distinction, right? Because so many of our listeners and so many clinicians work in a much larger environment. Obviously, there are many who work in small practices and small environments who will appreciate that comment and they'll really understand. But the point I'd like to get across is, what is a critical access hospital? What does compliance look like in this space? So I think that's a brilliant observation to make. So the other thing that I'm interested in, obviously it's a tight-knit community. You have to prioritize. What does your governance look like? Like, how do you report, Denise? How do you report issues?
So I have direct access to the CEO and to the Board of Trustees, to the chair of the Board of Trustees. Very good relations with them. And they, as part of onboarding and regular education, I provide updates on what's happening within compliance and, the importance of having that leadership involvement. So that really helps with that leadership understanding of why something is really as critical an issue as it is, so that they have a better understanding of what you're dealing with. So I also have a very diverse compliance committee, that includes additional members of the Board of Trustees. Also our leadership, some of our executive team as well is part of the compliance committee. But we also have frontline staff and individuals who are critical to have within the compliance committee itself. For example, our financial services, our billing team, our nursing. We have nursing staff, and we even have providers, a provider representative as well. So having those connections really is important as well. But from a leadership perspective, having access to the CEO and the Board of Trustees, whenever it's appropriate to get in touch with them, it's good to know that that avenue is available there. But also to have a robust committee that you can also rely on as well.
And I am absolutely, I'll say it again. Denise has heard me say this so many times because I genuinely mean it. I'm in awe of this compliance committee, and you can see why. There are representatives from everywhere, and they genuinely are talking. They carve out this time to be engaged. And to me, it's absolutely, when we were first plotting this podcast, I wanted Denise to talk all about the compliance committee, but then we were like, is that going to fill up a whole podcast episode? And we thought, well, maybe not. So let's broaden it out a little bit. But the truth is, I really am fascinated by this compliance committee, and I see it as like a model. That's the model that we should probably all be aspiring to, that kind of conversation. But Denise, how do you become aware of issues? Let's say there's an infection control issue or a patient safety issue. I mean, we're not just talking about quality or compliance, but how do those issues come to you?
They can come a number of ways. We have a standard hotline. We also have an event reporting system where anyone can enter their concern, and it can be anonymous. Both the hotline and the event reporting system are anonymous. We have a Dropbox that's also available. The old-fashioned paper pencil, drop it in.
It works.
Old-fashioned? Hey, wait a minute.
Well, it works. It collects dust more than it collects information, but at least it's there as an option. But because of people's comfort, and they know me, being in a small organization, I've had more people come knock on my door and say, hey, Denise, I have some issues or some concerns that perhaps you can help with. So there's a whole variety of ways where, we get information. But again, mostly through our event reporting system, because people are most comfortable with that, and it's accessible to all of our employees 24/7.
Okay. Denise, what do you think are essential skills for a compliance officer to be able to build the kinds of relationships where people come to you and feel comfortable. I mean, we all know, all three of us, this is hard work to build that level of trust. It doesn't come overnight. So what do you think, what are the qualities of a compliance officer that would maybe enable them, or they should focus on to build those types of relationships?
I think building trust is first and foremost, to actually listen to people. So having the ability to really listen to what the individual is saying and what they're experiencing, understanding that, it will give you a lot of insight and will gain a lot of credibility with you. If people know that you really genuinely listen and want to help, then I think that really paves the way. So listening skills and really communicating well. So communication and listening skills. Also having the ability to be flexible. We've talked about that before. You really need to just kind of go with the flow. So being able to just kind of bend and move wherever, the sea is taking you. Don't drown in the sea, just kind of float along with it. And, I think you'll be very successful. Other skills that I think are important, really presentation skills. Having strong presentation skills and knowing who your audience is. So talking to a board is obviously very different than talking to frontline staff, but communicating the message is just as important to both groups. So presentation, communication skills, listening, analytics. You don't have to be an expert in Excel or anything like that, but, understanding data and what it's telling you to be able to interpret it for others is something that people really rely on you for as the expert. So they're going to say, Denise, here are the audit results. What do you think? And to be able to point out, well, have you considered this trend, that trend, or are we seeing any patterns? I think an analytics background or having understanding as to how to interpret the data is very important as well. I'm sure I'm missing other skills, but those are the key things that come to mind for me.
I think we all have an idea of what those values are and we would agree on them, but every compliance officer also adds their own touch, right? And their own view. That's important. That's the point. I'm going to do an Elvan. I'm going to do an Elvan because I really am excited about this one. And Denise, you and I have talked about this a little bit. I think that's partly why I'm so excited. But brace yourself. No, I'm kidding. But you talked a lot about it is a very close environment, right? And there are benefits to that can be really fantastic. But how do you manage privacy issues and confidentiality issues in an environment that is so close and so community oriented? Do you mind talking to that a little bit and some of the challenges there?
Oh, absolutely. It's not uncommon where a nurse or any employee would have a neighbor or an acquaintance or even another family member having services here. And it's critical from the outset when we bring someone on board as a new employee and very regularly to really emphasize the privacy element. We say, you know what, you're getting care here. Let's treat people with the respect and privacy that they require and they deserve, because it may be you at some point, it may be you. Really emphasizing the respect and that we need to share with our patients. Unfortunately, there are people who want to look at their neighbor's chart and find out, oh, they just had a baby, and I want to know what the gender is, and that's
for
nice.
good reasons, even
good
good. It's
reasons.
not necessarily nefarious reasons, but
No, right. But really to remind them, would you want someone else poking in your record like that? So bringing it home, making it personal, is really important, and just constant reinforcement about you're only accessing what's necessary for you to do your job. And unfortunately, we have had instances where people looked into other people's records, and there had to be some corrective action that was made. And again, in a small hospital, people may have may feel the effects of that. For example, if an employee is taken off duty for a time, other members,
that's more apparent. Yeah,
it's very apparent. So it kind of raises the sense of, ooh, this was not good. I'm going to be very mindful and not do that here, because they do take it very seriously. And I really don't want to have a negative impact on my team as well. Most importantly, I don't want to lose the trust of my friend or neighbor or family member that comes in for care or service.
And what I'd like to point out is all the thought going in to this, the roles that you do and that you carry with you. Like, this is not an easy job. It's not an easy job to be a compliance officer, but even more in your situation, there's another layer that you're constantly juggling. You're thinking about, I mean, even if somebody needs to be disciplined, right? Like, what does that mean if everyone knows that they've been disciplined? Like, and it's not just an idea of, hey, well, are we going to have enough staff, or, teaching a lesson? But there are so many aspects of having to manage those types of issues, the compliance issue, quality issues, all of that, that I think takes, I don't want to say more care than in another type of environment, but actually it does make it, some of these decisions and choices and outcomes and how you handle situations, there is another component of it. Is everybody going to know? How does that affect the whole community?
Right.
In a way that maybe bigger establishments don't actually see or experience.
I mean, we need to respect privacy and confidentiality just as much as any other organization. But like you said, in a smaller hospital, it's people feel it or can sense that there's something afoot. And I think really being able to listen and talk to staff members if there's a significant event that occurred, having the honesty to saying, there was a certain event that we can't get into. We're looking into it. And in the meantime, it's best that, we're taking some actions, but we want to make sure that that you're being supported. So a little bit of transparency, acknowledging that something is different, but still protecting the privacy and the confidentiality of the whole situation. In a small
I love that. Yeah.
In a small hospital, the gossip line runs quick, and you want to make sure you nip that in the bud. And there is some element of saying, you know what? Yep, we understand something happened, but please respect that, we're working on it and that we're going to continue to support you.
I love that. I can imagine that's a difficult challenge.
I was thinking this may be an opportunity. Few things that came to my mind. I live in a rural area also, Denise, where the hospital that we have here is also the biggest employer. So it's not just your neighbor. Like, I mean, it's impossible to not run into those situations where somebody who works, whose family is also receiving care, or that they're friends with, like, you can't run away. they are the biggest employer. What are you going to do, right?
Right.
But one of the safeguards that, so I do know that they had a policy that maybe a bigger organization in a more suburban area wouldn't think about at the time of hire, where going beyond the normal privacy expectations, they had a policy about truly laying it out, saying, hey, we're aware that we serve a small community. You know, you may end up being assigned to a family member of yours. Please let us, like there was just quite a bit. I know this from a family member of mine who worked in such place.
Mm-hmm.
So, I mean, maybe taking it a step farther to implement yet another policy. Yeah, nobody likes one more policy, but to protect that like you said, at the time of onset. Another safeguard that they had, which I thought was brilliant actually, was, anymore we operate off of EMRs, right? So, IT was flagged when, if a clinician accesses a patient record that they're already not assigned to, then it was a pretty quick, hey, why'd you access that? Just a simple question, right? And that's a great moment of education before it gets to the point of corrective action, is to be able to say, hey, IT alerted us that you accessed it. Is there anything we can help you find there? Oh, it's my neighbor. You can't do that. Well, the wife still can't do that.
Yeah.
So
just, luckily,
just extra layers.
Yeah, luckily through our electronic record, we have that access scanning, and we do check that on a regular basis. And if there is something that pops up, we're not going to just jump in with an accusation without checking that out first, whether or not it was an appropriate access or not. But definitely, I call it, and most people are aware of the term just culture, where the level of response or discipline depends upon the level of the issue. If someone did something unintentionally, then it's an opportunity for education. If someone is doing something repeatedly, it's a pattern, then that raises the level of intervention, if you would. And then if there's some outright nefarious breach or ill intent, then that leads up to more significant action and sometimes even termination. But just culture really helps us and helps people understand that you're not going to get in trouble if you do something unintentionally or if you didn't have the right training. But we're going to look at it through that lens. What systems are in place or not in place that allowed this to happen? And then it's our responsibility as an organization to fix those systems so that people are more comfortable knowing that, they're not just going to get fired for an inadvertent breach or issue that occurred. It's going to be looked at through that lens.
And that's another thing I really admire about your leadership in the hospital. There's a really strong focus on ethics and ethical leadership and ethical working. And that's something else that, I really love. But we're rounding out. We're getting to the end of our show. But before I go, I'm going to do another Elvan. I have to ask. So, we've talked a lot about the advantages and the benefits of having a more rounded role or being able to see across different kinds of activities. And we've talked about the benefits of working in a smaller community in that way and supporting each other. But truth is, you're managing an awful lot with your different hats. So what are some of the challenges that you face?
Wow. It's easy to get overwhelmed and spread thin. But again, knowing how to prioritize and just every hour saying, okay, what's the most important thing now? and then work on that, and then just constantly reevaluating what's the most important thing, knowing that you are not going to accomplish everything that you set out to do that day. And again, the flexibility is important. Having clear goals and objectives and an end game. Here's where we want to be, and here are the resources I need in order to make that happen. And speaking up and asking for help. That's really important. You can't do this alone. That's why I rely on my team. I have my infection preventionist doing, patient experience work. If there's a patient complaint or some issue that comes up, then he will take the reins. People are willing to work together outside of their comfort zone if necessary to make whatever it is that you need to have done. I think that's the benefit, again, of a critical access hospital. The challenges are knowing when to say, I need help, and not to be afraid to say it. Many people are like, I'm never going to admit that I'm drowning or that I need help. And it's just going to cause, stomach ulcers.
Or mistakenly thinking that good leadership is doing it all by yourself. When actually that's a terrible approach.
It is. Good leadership is relying on others. And
100%.
getting things done as a team.
So, Elvan, did you have any questions that we didn't get to?
Not necessarily. I think this has been very informative. I don't know the statistics, but I would like to think that a lot of our areas are serviced by critical access hospitals. It's a such needed service. And just because it's small, it shouldn't mean that, as you said very openly, any regulation needs to or should be allowed to fall by the wayside. Patients still deserve the best. And it really takes it seems like a very strong team to uphold the ethics and compliance.
Yeah, and I do see Monadnock as a leader in that sense of how to do it well. And that's the insight we were all hoping to achieve. Like, how do you manage in that kind of environment and that kind of setting? And we don't often get a glimpse under the roof, do we, in that sense? So I think it was important to have the conversation and understand, well, what's unique about a critical access hospital? Do you get any passes? Clearly, no, you don't. And how do you make the magic work?
I had to ask.
Denise, was there anything that we haven't asked you about that you think is important to mention?
I think, again, having leadership support, also, being creative with your tools, your resources. If you don't have, for example, a compliance platform that you're already using, explore those kinds of opportunities, because the more you can make your day-to-day tasks automated or easier to manage, I think the better off you will be, and you'll be able to focus your attention on things that matter, like working with individuals. So not to be afraid to ask for tools and resources that help you with your day-to-day work as well.
That's absolutely superb. And with that, we're going to come to a close. Denise, thank you so much for being a guest on this episode and for, coming on and sharing your thoughts with us. It's been absolutely brilliant.
I had fun.
Thank you so
much. I hope so. Hopefully we haven't scared her off, folks, and she'll join us for another episode. Denise is like, no.
No, we're good. I'd be happy to join you again.
Thank you. And thanks, Elvan. We'll see you guys. I'll see you later, Denise. Elvan, I'll see you next time.